Just count down, let us know.
We are.
Okay. Good evening. This is the North Andover Board of Health meeting on Thursday, March 24th, 2022. I'm Joe McCarthy, Board Chairman, and other board members present are, to my right, Dr. Pat Scanlon, he's the town physician. To my left, Michelle Davis, she's the board clerk. To her left is Dr. Max Tilson. And also department members here right now. Two over to my right is Brian LaGrasse, he's the director. Steve Casey, he's the inspector. And Carolyn Lamb, she's the town nurse. So we have a quorum, and the meeting is called to order. And the first order of business is the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. It's somewhat refreshing looking at the agenda here because for the last 2 years, the agenda has been almost exclusively the pandemic. So hopefully we're getting back to a semblance of normalcy, whatever that means. Approval of meeting minutes. Michelle?
We have two sets to approve today, December 16th, 2021 and January 27th, 2022. Both have been reviewed and edited and are ready for approval.
Okay. A motion?
I'll make a motion.
Second?
I'll second it.
Those in favor say aye.
Aye.
Motion approved. New business. Kathy Schultz, she's the director of our senior center, is here right now. And before I introduce her, if you look at the death certificates with people that have had the coronavirus since the pandemic, in North Andover, as of last week, 104. People 40 or younger, residents of North Andover, 0. People 40 to 49 in North Andover, 2. 50 to 59, 4. 60 to 69, 7. People 70 or over of the 104 who have died in North Andover, 91 are 70 or over. So it's been catastrophic for our seniors. And I asked Kathy, I know her quite well, to speak with us about what we have done, what we are doing for the seniors, and last but not least, the senior center itself, the new senior center. So with that, Kathy, it is all yours.
Where would you like me to be?
You can stand at the podium if you'd like.
Okay. So thank you all for having me here tonight. I hope I can answer your questions. A lot of what we know is all anecdotal. There has not really been any direct research or anything done in North Andover to kind of see how the pandemic has affected our older residents and what they're doing. Was there specifically something you wanted me to address, Joe?
No, not really. As I said, just wing it. And what are we doing right now, for example? I know the senior center is not completely open.
Oh, no, we're open. We're open
Well,
full
you can't
scale.
have a meal there.
Oh, yes, we can.
Oh, you
yeah,
can?
no, we're open, full service, having meals, no masks. There is no
as of last
longer
week, they
physical.
said no
we,
meals, so-
since we reopened in February, so we were closed in January.
Okay.
Since we reopened in February, we didn't do meals, but then starting March 1st, we were doing more.
see.
So for full open, full service meals, all our programs. The van's going out, and the van never stopped going out. So we provided transportation. Going out. We're seeing, trend-wise, we're still not back to pre-COVID attendance. And one of the biggest fears, I think, going into the pandemic were that people were going to get used to stay home. When you first started, you closed for 2 weeks. We never really dreamed what it was going to turn into. And we all know how hard it is to change a habit, and you get people coming and getting used to coming out and coming to their programs and their exercise classes or whatever they choose to participate at the center, and then you stop that for a long period of time, and then people start new habits, and they get used to staying home. and it's hard to get moving again. And that was really one of my biggest fears during this entire pandemic, are those people. And we're seeing a piece of that. You have some people that come out, they were very anxious to get back in the building and happy to be there. Some people that were waiting longer. We still have some that are still wearing masks, and there is a population that is still staying home, that are just some are consciously not going out, and I think some just got used to being home.
I have the
Coming back
dubious
out.
distinction of being the only senior on this board. And I had been a member of the Council on Aging in the past, and I've talked quite a bit about the seniors. Because again, that's a segment of our society that is in need, perhaps most in need. And statistics as of a year or two ago said that 19+% of all seniors in North Andover were living in abject poverty. And typically that is a woman who's a widow. And a lot of these seniors have been cloistered. They haven't gone anywhere. They haven't done anything. They have few friends. They have few relatives. They're all by themselves at home, and some are. And that's why it's so important to get out the message about our senior center. Because I've been to most of the senior centers in Essex County, in other parts of the state. And from my perspective, we are perhaps the best, the very, very best. So get the word
take
out.
that on.
Also, I'd like to talk a little bit about our new senior center, what the timeline is, and what will be offered.
So, so the timeline is right now February 2023 to move in there. As you all know, there's in a construction project, it's always can be. A lot of surprises come up, and right now during COVID, another is this whole, getting product and that kind of thing. We don't know what could hold us up. There's a lot of unknowns in this really unusual time of construction. So right now the plan is 2023 in February, and they're doing very well. The construction company has been extraordinary in getting product in, but we don't know what the holdups could, come in the future. I'll give you an example of holdups. So the senior center, had a capital improvement to buy a new van. That van has been ordered, and then we got a call from Ford that they're not making them right now, and they don't know when they're going to start again. That if we wanted a police car, they would be happy to get that for us, but we can't get a van. So we're sitting on a van right now that we can't replace. And so the same thing, with the building, we're just going to sit and wait. And in the meantime, we have a nice, safe location to meet in, and when we can get in, we do. The building will be beautiful when we move in, give us a lot more opportunity with a fitness center with state-of-the-art fitness equipment in there to be able to use great spaces for public presentations with this type of equipment, with screens and projectors and incredible acoustics and things like that to use for the building. So we're anxious to get in there.
Very good, very
Yeah.
good. Correct me if I'm mistaken, because I know the size of the new senior center has changed a number of times, but basically it'll be twice the size of the senior center
Just
that we
about,
have right
correct.
now.
Yep.
And you mentioned that we have the old van. In the past, if people were incapable of going to the senior center for whatever reason and needed to be picked up, do we still do that now, even though we have the old van?
Of course. So we have two vans, and one of those vans is the one that we're going to replace, which it needs a new air conditioner. We couldn't get the parts this summer to fix the air conditioning because of this whole issue that's going on. So we still can drive it. It still works, still runs. We're not going to be able to drive it when it's 90 out because it doesn't have an air conditioner, but we still are doing it. We've actually increased our transportation. One of the things that I did notice when I came to North Andover was that the van was not doing, we could do more. And we have been doing more. So now we provide transportation to medical appointments. If you want to get your hair done, go shopping, wherever you need to go, we're transporting you. And so we're working really hard to build up that transportation. We have two vans sitting here. In my opinion, they shouldn't be sitting at all. They should be moving 8 hours a day. And so that's our goal, to increase ridership and make it a little more known that we're here. I think it's one of those best kept secrets.
Let's
we're
be a little
hearing.
bit more known. A lot of this information that you're passing by us right now is available on our town website.
Mm-hmm.
So when in doubt, just go to the town website to find out more. Or it's as simple as making a phone call to the senior center.
Give us a
And the
call.
number is?
Yeah. Oh, you're going to quiz me, 978-688-9560.
Terrific. Okay, and remember that. Good. Any other questions for her at all? Well, thank you, Kathy, and
Well,
probably
thank you
come
so
back
much.
in like another 6 months or so to tell us what's happening at that time. And hopefully, we will not have to wear masks. And to focus on the new senior center, which will be that much more.
Yeah, so I just want to, just a little shout out to us. We are having, it'll be our first annual on June 24th and 25th, our first annual North Andover Conference on Aging. That's going to be open to the public. We have a keynote speaker on Friday night. Ted Reinstein from Chronicle will be our keynote speaker on Friday night. Author who has written a book called Cruising Through Caregiving. Jennifer Fitzpatrick, who actually has roots, she's in Virginia, but has roots in North Andover. She will be our speaker on Saturday night, and we have educational sessions that'll go on Friday afternoon and Saturday morning for the public. So mark your calendars.
There's a lot of additional information available, too. Like I know a number of
Yep.
years ago, I worked on living options available for seniors here in North Andover.
Yeah,
And
we're going to
since
have a
that
session.
time-
We're going to have a session on that as well, Joe.
Well, since that time, you barely see my fingerprints on it. It's much, much better with
Yeah.
the input from so many other people. But when in doubt, seniors, please contact our senior
Yeah, give
center.
us a call.
Speak with Kathy and others, and they'll put you in the right directions. Because we know that this has been very, very hard for our town seniors as well as all seniors.
Yeah.
So, again, when 91 out of 104 deaths in North Andover, people having the coronavirus,
Yeah.
have been people over 70. That raises a big red flag. So keep up the good work,
Well, thank you very much, and thank you for having me.
and thank
Have
you
a
for
good
being
night.
here.
Thanks,
Okay.
Thank you.
Okay. Public hearing, Brookside Homeowners Association, a lifeguard proof variance. We've gone through this a number of times in the past, but nevertheless, here we are again, and this is required. So
Yes, it is.
please introduce yourself and talk about what you're looking for.
My name is Patty Heenan, here with my husband John and Pat Hennessy. We're all members and unit owners at Brookside Homeowners. This is my 10th time coming in front of this board.
As I said, you've been here in the past.
For a variance. However, this is the first time I've seen Stephen Casey's face. The last 2 times when I worked with you, we had to have masks on, so this is kind of nice to actually say, hi, it's nice to meet you. And hopefully when I see you in May, we won't have them on. All right, so let me talk a little bit about Brookside. Like I said, I've been coming here since 1989. You've been issuing us the 3-year lifeguard regulation variance. In the 30-plus years that the Board of Health has issued the variance, Brookside has had an excellent safety record. We are a small 29-unit community with a tight operating income. The Brookside pool would be forced to close if the Board of Health chose not to issue the variance. It is the centerpiece of our community. I don't know whether any of you have been in there, but it's very lovely. We've done a good
So
job.
if we get
of-
like a free day pass or something like that?
Sure, you can come as my guest, sure. So we're here to request the variance again. I feel like the past 2 years, I've had to work very closely with Stephen last year. I think we were one of the few semi-private pools in North Andover that were able to open because of COVID. We lived up to, and I should have brought the books with me, the strict protocols that the state of Massachusetts put on semi-private pools because of COVID, as far as wearing masks, social distancing. We could not put out any of our pool furniture, but they had a whole list of things, and I think, well, I shouldn't say I think, I know we did a great job of it. We had a very successful past 2 years of pool year. We've not ever had an incident at our pool, so. With that note, I'm just standing here requesting a variance for 3 years.
As has been requested, as you just noted, many times in the past, and
Yes.
I've been here doing many of those.
Yes, you have.
Yeah, so, a question, further discussion?
Do you have any
At all?
reservations?
No, so yeah, we worked pretty closely the past
Yeah.
couple of years, and even with all the extra like rules and guidance regarding COVID, I haven't ever had like a complaint or an issue with the pool. Even during inspections, they've been pretty on point with everything they do, so I don't have any issues.
Questions?
No.
Okay.
Make a motion to approve.
He made it last 3 years ago.
Okay, well,
I don't think I was here was I here 3 years? Wait, maybe it's 2 years, sitting next to him too long.
well, you can second it.
Okay. You make a motion?
I did make a motion.
Okay, just state the motion again.
I make a motion to accept the variance for the lifeguard pool at Brookside.
Yep. So it would be a 3-year like length for the variance, and then they could come before the board again.
Is there a second?
I'll second that.
Okay, all in favor, say
Yep.
aye.
Aye.
Approved.
Perfect.
Thank
Thank you so
you.
much. Much appreciated,
see you in 3
Stephen.
years,
I
so.
look forward to seeing you.
I've seen a couple months.
Yeah, right.
Cool, yeah.
You made the motion, I read. I know.
Oh, that might have been like one of my first.
Take care, guys.
Have a good night. You know what, I've been here for 3 years.
Hey Steve, can I ask one thing?
Yeah.
In people who, so this is a lifeguard variance.
Yep.
If there's a public pool, what's the role of the health, or your role for inspecting, say, chlorine levels
Yep.
or stuff like that?
So we do the permitting and the inspection. So like the permitting, we'll look over if it's a public pool and they're actually having lifeguards. We'll look over their certifications to make sure they're current. So things like first aid and lifeguard training. When we do the inspection, like a lot of it is the big things are the chemicals, making sure all the chemical concentrations are within the ranges they allow. We do basically like the safety side of it too, making sure things like the main drain at the bottom of the pool is covered and that's secured. The turnover rates for the water is within the allowable time frame, which is under 8 hours. Making sure the enclosure I can't talk. Yeah, the gate latches itself. So that way, if someone comes in and leaves it open, it's not open for like a kid to walk into. There's a lot of different little aspects we check, but we also work with their CPOs, which are their certified pool operators, just to make sure everything's in compliance and setting up inspections and such. So,
Do you guys do that for private pools at all?
no.
Private pool will be a personal pool at your house.
Right.
Only semi-public and public pools.
Yep.
We don't have any public pools in town. It's all semi-private or semi-public. So condo associations, things like that. And
Okay.
we have a very extensive inspection protocol that we go through. We even go through the first aid kit
Yeah.
to see what they have and there's requirements. Signage, life-saving equipment, filtration, covers, decking, unit gate, latching, height, you name it. There's a lot that goes into the inspection, and we do that every year when they open up.
Okay.
And then the lifeguard, it's a policy that the state puts back on the local board of health to determine what you guys do for lifeguards. We require lifeguards in here via policy, but it's not anything that we would have to. You can give variance for it.
Okay.
So for Brookside, it's a very small association. There's only 29 owners. So to put full-time lifeguards
Yeah.
7 days a week on 29 people,
Right.
it's very, very costly. So that's kind of inhibitive for them to have lifeguards, but every other association in town has much more units. So the costs are much easily more deferred throughout the entire population.
Can they define the hours of the lifeguard being there at those other pools? So can they say like the pool's only lifeguard, the lifeguard here from
Yes.
10 to 2 or whatever, it is, or
Yep.
10 to 4?
Yeah.
Okay.
And then I think every place has lifeguards are there while the pool's open.
Yeah.
Then the pool closes and lifeguards can leave.
Okay.
But
So-
you can't go in there if
see.
there's no lifeguards.
Okay.
Yeah, they basically unlock the place, and then
Okay.
when they leave,
Yeah.
they lock it up.
And they do. And lifeguards also check the chemicals 4 times a day. CPU only comes out once a week.
Yeah. Okay, thanks.
Housing complaint. And this is 15 Maple Ave, unit number 2. And please introduce yourself.
Sure, definitely. Well, thank you all for having me. My name is John Trapotis. I reside at 142 Rosemont Drive here in town. My wife actually has a small business down the street on Main Street, and I'm also in the medical field. I work for Medtronic. But I also own one more property at 1517 Maple Ave. And,
This sounds like an old story. Go ahead, John.
So, yeah, I've owned the property. It'll be 20 years next month. So I, raised my family there, particularly because we settled in North Andover because my wife has a small business here. It's a hair salon down the street on 16 Main. And so we've lived in 2 out of the 3 units before we eventually moved over to Rosemont. And so love the neighborhood, the neighbors, really close to them and all. In the last 20 years, never had any health department concerns. But I have a tenant currently that actually moved in on September 5th, 2017, okay? Now, prior to them moving in, I renovated the apartment, so I had it completely painted throughout. I had new cabinets, new countertops, backsplashes, including a new dishwasher. So, moving forward, this past May, so it's a tenancy at will. I gave notice to the tenant, more than 30 days, so 30-day requirement, that I needed the unit back for family members to move in. He didn't move out. I gave him another 30 days, just so, give him more time. Could see that nothing was gonna happen. So I proceeded with an eviction process, okay? So we've been in process now, from August, and I can even just kind of, you can see, that it's, you can see some memos there. So we went through multiple hearings. And, so come through up to December 31st, we finally have a court date on this upcoming May 4th, okay? But now, so a few weeks later from there, all of a sudden, I get a complaint from the health department with a list of, mice and plaster and dishwasher. So so to begin with the mice, okay? So I have a contract with the exterminator.
Maybe we just have Steve just give us a background about what was found, and then, because I just wanted to kind of get to know, all the charges and everything like that, and then this
Okay,
way.
yeah, absolutely.
Please,
You
thank
see,
you.
unlike the dreaded private sector, we don't have the opportunity to review this before the meeting.
Oh,
It's
okay,
all an
okay.
open meeting. So when he
Okay.
said, can we have Steve speak?
Absolutely,
It's-
yeah,
it's-
Steve and
it's-
I have-
It's new
Please,
to us.
okay.
So go ahead,
Yeah.
Steve.
So we ended up getting a housing complaint, like John said. We went out and did an inspection, I believe, the end of January. We drafted a letter and sent it out, and John had appealed the letter, I believe, once he got it. The violations we cited basically were the dishwasher, like John had said, it wasn't running, it wasn't generating water for some reason. There was mice droppings throughout the unit. There were damage to the plaster on the walls in areas. There were a couple areas where we saw that mice seemed like they could get in one particular area, which Laura, who used to work with us and ended up taking a position elsewhere, noted there was a vent that was open and potentially allowing rodents into the unit. And I believe that was it. And to John's credit, he did have the pest control company out 3 times. One was before I got his appeal, and then 2 were after. And in your packets, you can see I included copies of the pest control. But is that, yeah? So that's the overview of the housing issues, though. And so a lot of the repairs have been on hold just because he put in an appeal to come before the board, basically, so.
So obviously, you're the owner.
Correct.
How about the tenant? Do the tenant have the opportunity to appear in front of our board too?
Yeah, so
and refuse not to?
I talked to him, I think I've been by the unit 2 or 3 times, and each time I mentioned it to him, and I believe we sent him a copy of the letter that we sent you to basically notify him of the meeting. And I told him if he wanted to come in front of the board, he could have, or wanted to come watch the meeting and be here and be present, he could, but he
So what
didn't
is the
have to.
tenant looking for? Other than voicing a number of complaints that appear to have been addressed, what is the tenant looking for?
I think the tenant is just looking for these items to get corrected, as far as like what we're concerned with.
Have they all been corrected,
he
or
does-
any outstanding right now?
Well, I'm here because the mice have been, well, I'm trying to correct the mice.
Yeah.
Good luck.
Well, so Proof Pest has been out, again, as mentioned, 3 times. So the first time, they placed all the bait, if you read the report.
Yep.
Now, they went again the second time. They're not seeing activity in the bait stations, so they were clean. But it's still, it's very dirty in there. You know, the droppings are still there, but they don't know if they're new or old. I mean, and they actually, Proof Pest went again yesterday, and they took pictures of trash being left in the hallway, and I've had numerous complaints from my other tenants that, you know, that it's not clean. So, but the other tenants aren't complaining about mice. They haven't had any concerns, but if you look at the condition, and I think Steve can attest to it, you know, more than I can, you know, it's not clean. Now, the plaster, you know, that's inflicted. I mean, the walls were newly painted. They were, so you got the dishwasher. Not only was, and I have copies of my dishwasher, but not only did I put a brand new dishwasher before they moved in, I put a dishwasher 2 years after. So they broke that one. So now I come to find out they broke another one. So, you know, and, you know, so my ask here is, I'm going through this process, eviction process. I have a court date for May 4th. I want to be able to take care of the remaining items after the tenants vacate before my new tenants. That's why I'm here for my ask.
And correct me if I'm mistaken, but the dishwasher, the new dishwasher, that has since been, that's inoperative since the tenant moved in. The owner is still responsible because it was there at the time that the tenant moved in.
Yep.
Am I correct on that?
Yeah, so
Okay.
there's nothing in our code technically mandating a dishwasher, but because it was there and it was installed with the unit when they moved in, it's technically the owner's responsibility to maintain those items.
But I put a new one in while the tenant's there. 2 years into their tenancy, I installed
Yeah.
a brand-new dishwasher.
And it's not working.
No, it worked for 2 years up until we
Yeah.
just found out
Yeah.
a few weeks ago
Yeah, so-
that it doesn't work. That's the first time I heard was when I received the notice.
And
So I didn't know that they broke another one.
Yep. So that's the difficult thing is if, you know what I mean, if obviously that is true, when we're there, we have to cite what we're seeing at the time of inspection. So obviously, like, I wasn't aware of any of this going on, but once we're there, we have to cite basically what we see. So because I'm showing up and it's not working while I'm there in the unit, that's why we were citing it.
Right, no, I understand, but I'm just giving my
Yep.
feedback.
Yeah, no, of course.
I put a new one, and you can see the receipt right before they moved in. I replaced it 2 years later, because they broke it, and now it's 2 years after that, it's broken, it's another one, so.
And to John's other point too, so the last time I went to the unit, the first time me and Laura went by the unit, we had mentioned to the tenants, you know, it's obviously not in the most sanitary condition. We had mentioned cleaning it up, and then when we went back for an inspection, I want to say a week ago, 2 weeks ago, somewhere in there, I told them basically, look, like, if you guys want the mice to go away, he's been sending pest control, but if there's trash around here, you know what I mean, there's food waste, stuff like that, it's not giving him reason to leave. It's going to hang around, so you guys do need to obviously clean this unit. Otherwise, he could send the pest control in as many times as he wants. He sent them in 3 times,
not
you
gonna-
know,
right.
and that's what makes it difficult. So the tenants have been told they need to clean up the unit as well, basically.
Is it an unsanitary
Yeah, so it's like, it's not to a point where I would condemn the unit or anything,
Yeah.
but it needs to be
But it
cleaned
just
up,
attracts
basically, yeah.
mice.
There's food sources and sources
Right.
of harborage, yeah.
The
So-
mice is gonna go for the french fries versus the steak.
No, of course.
Improve Pest took pictures and noted in their report yesterday that
Yep.
trash and the, where the,
My question is, where does the law stipulate that the tenant has made good effort to mitigate the pest, but, sorry, landlord
Yep.
has made good effort to mitigate the pest, but, by showing proof of
The pest
them
control.
coming- pest control coming
Yep.
out, but, you're kind of limited by what the tenants are doing.
tenant is doing. Okay. So, it is kind of one of those areas where both parties have to work together, and unfortunately, one isn't as doing as much as the other. I believe there's citations in the housing code that adhere to the tenant's responsibility to kind of maintain the property and keep it in a sanitary condition. Because it's not obviously the landlord's responsibility to come in and clean up after the tenant every time there's a mess. So that's what we talked about with the tenant on site at my last visit, was saying, hey, we were suggesting this the first time, now we're telling you, you guys need to clean this up because the mice aren't gonna go away if you don't.
Do you know what the tenant is looking for? I mean, obviously, since the notice of eviction around that time,
The only
there's been
thing-
this
so-
complaint
the only thing
with
we
Yeah.
the
comment
Department
on-
of Health.
That we don't,
So-
unfortunately, we don't get involved with
What's
the,
your,
the,
what's the board's recourse if they don't clean up the unit?
we,
So what do we do? So we tell them to clean the unit up, or the mice aren't gonna go away.
Yep.
Give an official order.
So that
So-
would seem to be the next step, wouldn't it,
Yep.
if they haven't cleaned up?
yeah. So the plan was to, again, like I said, at the, we went by last time, I told them they had to clean it up. When I was gonna go by for a reinspection after, if they hadn't cleaned it up at that point, we were gonna send basically an order letter, similar to this, but geared more towards the tenant than
Okay.
the landlord.
I mean, that seems to address the pest issue.
Yep.
That seems
The
reasonable.
dishwasher issue, I think that unfortunately, as you say, if you, it sounds like if you rent something that has a functional appliance, the code says it has to remain functional
Yes,
even if it's been replaced.
yes.
So I think that from that standpoint, you're sort of stuck.
I think he wants to.
I want to be able to replace it. I just want to replace it. We've got a lease that's terminated
Yeah.
right now. I want to replace it before a new tenant goes in.
Clearly, right.
Yeah. That's my ask, because I could put a new one in tomorrow, they'll break it again.
Right.
It's a shame that the tenant is not here right now, because, we only have one side of the equation, which is, from my perspective, valid. And around the time of the eviction, this information makes its way to our department. So is it coincidental or not? Personally, I doubt that it's coincidental. But where to from here? And that we just got this information, we haven't had the opportunity, nor could we have gone over it before the meeting. What is your recommendation from here?
So what I was gonna recommend was, as far as the violations in the letter go, obviously we shouldn't waive any. I usually don't really push for extending the deadlines and such, but with the situation where the tenant needs to clean the unit, or else it's not going to let the landlord remedy them as he wants to, I wouldn't be against pushing it out maybe a week, maybe 2 weeks at most, just to give the tenant time to clean the unit to the extent where basically the mice won't be an issue anymore. And if he has to have a contractor or someone go in to fix the remaining items, they can do so.
Brian, any comment on that?
I don't know, follow Steve's recommendation on this one.
So I'm gonna have to get a new dishwasher and fix the plaster that they knock in.
Unfortunately, yes. With an extension, of course, but it's something we can't, they're not major issues at this point. You can order a dishwasher now, get it installed when it comes in, get a contractor lined up to do the plaster in a few weeks after the unit's cleaned out.
And the other thing is, we would go in once your repairs are made, and once we verify that they're made, you have it documented. So if you do repair like the plaster on the wall and it gets damaged again, it's pretty obvious what happened. So,
Yeah.
All right, so it would be, we make sure, I get the go-ahead from yourselves that it was thoroughly cleaned before I can get a contractor in and call the appliance store that has to,
so
you know,
yeah,
install
so
a new dishwasher again.
It's under warranty
Pending-
right now? You say it's 2 years old. Do you have a warranty on that, or has it expired?
I'm sure it's expired after.
Well, not necessarily.
Yeah.
Not necessarily. So, like
Yeah,
if you bought it at, say.
Did you verify that it didn't work?
So when I went in, we tried starting it up, and I don't know if it's just the water isn't coming out of it or what it is, but it didn't seem like it was starting to run. We sat there for about 5-10 minutes to see if it would kick on and the water
So I
would
have to
start.
actually confirm then.
Did they shut the water
Is,
off?
yeah, well, that's
don't
right.
believe
I mean,
so,
who
but-
knows?
It wasn't working basically when we got there, which is why we cited it. So
So it doesn't necessarily need to be replaced, it could just, we could just
Repair.
get, we could
it could
see that it
either
was
be like
repaired.
we.
It's 2 years old.
My dishwasher died after 2 years,
Yeah, mine did.
and I didn't beat it up.
This one's 2 in a row, though. Did you have two of them?
No, this was a brand new dishwasher from Appliance
Steve,
Corner.
did you write
It was
a
very
letter
expensive.
to them to clean the house?
I haven't written one yet, but my plan was to go back after the meeting and after I gave them basically what we decided. And obviously, the last time I went, I told them they had to clean it up. If I go back and it's not cleaned up, I'm going to send out a letter.
And then what is?
Can I have a copy of that letter?
Of course, yeah.
I'd prefer if you sent it out now, before you go. I mean, you've been
Okay.
there 3 times. You got proof from yesterday, from Proof Fest.
Yeah.
Look at the photos. You know, I'd rather see the letter go out now, and I'd like to have a copy of that, too.
Okay.
So what is his timeline if a letter goes out to the tenant and they haven't mitigated that?
We'll give the tenant a couple weeks to.
We wouldn't enforce anything on him if the tenant isn't cleaning up.
Okay,
That just wouldn't be right.
so I agree. So
Yeah.
if just to play this out a little further, if the tenant doesn't clean up, then none of these citations hold. Is that what happens, or what happens then? So we cite. So I'm playing devil's advocate.
They would still hold. We would extend the deadline for, say, 2 weeks after the tenant has a deadline of cleaning. So those would definitely be enforced. If the tenant doesn't clean, then we enforce that on the tenant.
Do we need to separate each one out?
It seems like
No.
it.
Yeah.
No?
You do
No,
not.
we can take the
connect
tenant
them
stuff
all?
on our own. We can
Yeah.
make a motion to
Are you
extend the
talking about
deadline.
these individual ones?
Yeah, I
You don't
mean,
have
I
to do them
think,
individually. You can do it all at once.
Well, because the problem is if the tenant doesn't clean up, we're not gonna get rid of the
Mice.
mice.
Yeah.
Correct.
And
So
you're not gonna
that
send a
he's-
contractor in to clean up the wall.
Yeah, I mean, to try to go in
Right.
there,
It
right,
seems
I
like
mean,
that.
it's unsanitary as it is, right in there, it's disgusting, you know,
So I would say it really should be something like that he would have a certain timeline after
After
you
your
give
inspection.
the okay
Yeah.
of cleaning.
yeah.
That
Yeah,
works.
Yeah.
that's kind of what I was thinking. Was it might be better to word it like that, as far as like once it's deemed clean, basically you have a X amount of time from that date, and then I could communicate that with John, obviously.
And about what are you looking for in that at this time? Because if we make a motion, then it'd be nice to have a hard number in it, if at all possible. A
I'd-
couple weeks,
Yeah, I'd say a week or 2 weeks.
2 weeks?
Post.
I'd like extensions as long as possible and doing the remaining repairs so I can get to the court date.
I mean, I
You
just
know,
also
that-
don't-
That's where
I just don't know whether or not, especially with COVID and how contractors are now, is
Yeah.
a week or
That's a
two
good
really
point.
gonna be enough time?
as well as
Just
appliance.
Gotta get a contract.
I'd also
right?
actually ask, even the appliance, it's an 18-inch, it's not a regular size.
I noticed
So-
that. That's not an odd.
it's-
That's an odd size.
It's an odd size, so I don't know what supply chain this is, how quickly I can get a new
What we
dishwasher
do.
in too.
Sorry. What we do is we would give you, say, like 14 days from the subsequent to their deadline to hire a contractor and order the appliance.
So if you got like an agreement from a contractor,
Correct.
and if you got a receipt for the appliance, yeah.
Or
Yeah.
could he engage a repair person
Yes.
instead
Yeah.
within those 2 weeks too?
Yep.
Just get the dishwasher either in working order or order a new one.
Correct.
Yeah.
Okay.
Yeah.
If you
Well, I
got-
need to bring in the appliance people in anyway to assess it first. I mean, I'm not sure it's even broken, you know.
Right.
Okay.
I need
And
to-
that works.
Right, and then I would need time from there to be able to
And then
have
just
them
make sure
order.
that they draft up that it wasn't broken, or?
It is broken.
Yeah.
They'll give you a report when they get over there.
Yeah.
Take a look
Yeah.
at it. They'll give you a
I
write-up.
use A&M, so
Yeah,
on this one, I'm
okay.
gonna use them, for repairs, so.
Gotcha.
Okay, so we need a motion on this,
We do.
okay?
So I guess I'll make a motion to, I guess, formally enforce these violations 2 weeks after,
When we deem it clean,
when you
basically.
deem it clean.
Okay.
Probably needs a better wording than that, but we got the gist.
Make a motion to issue a citation to the tenant
Oh, yes, make a motion.
with a 2-week deadline from receiving the notice, and a
Subsequent motion to extend
subsequent
the
motion to
deadline.
extend the deadline for him.
2 weeks after that.
After that.
I'll make that motion.
Thank you.
There we go. I'll second that. I can second that one, thank you.
Did you second your motion? Is it second? All those in favor say aye?
Aye.
Motion's approved.
Okay,
So, John, I'll send you a letter with all that in it,
yes.
and I'll send a copy to the tenant too.
Okay,
Okay.
perfect, I appreciate it.
Yep, thank you.
Now, we
you.
all live in North Andover, and I hope we bump into you again sometime, but we really don't want to see you here for the same issue going forward.
Thank you, I hope not, definitely.
But I understand, there's only so much we can do.
No, I understand, yeah, I mean, it's it's kind of like pretty ironic, after all the hearings, when this all happens, that.
Oh, yeah.
John, do you need these back?
Sure. Unless you.
Old business, Board of Health, 2022 meeting schedule. Brian, comment?
Let's see. Are there any issues with the April meeting? I think school vacation's the week before, correct?
Yeah,
I think so.
Okay.
The only month that we may want to look at closer is August, because traditionally, we do not have a meeting in
Correct.
August.
Yep.
It's vacation time, but we can leave it open right now for a little bit longer. We'll
Okay.
see. You know.
Yeah, we can make a
Well, you know, like, I
determination
mean,
this
during
summer.
this pandemic, we've missed meetings, and then we've had extra meetings too, so
Yeah.
I just want to leave it open right now, maybe another month or so, talk about it. And
Okay.
Do
We'll
we have
see.
to make a motion to approve the 2022 schedule
Yes.
for the Board of Health?
Yep.
I make a motion to.
I'll second that.
Is there a second?
I'll second that.
Okay, all those in favor, say aye.
Aye.
Motion approved.
Perfect.
Okay. Communications, announcements, and discussions.
Yes.
COVID-19 updates. Brian,
sir.
it is all yours.
We'll keep this one brief tonight. I did put in your packet last week's charts and numbers report that we post online every week. Let's see, so our vaccination numbers are still going up, very slowly at this point, but they're still going up.
How
Our
are the
overall
clinics
rates,
you guys are doing?
what was that?
How are the clinics you have been running recently?
Good, we just finished up today, actually.
Yeah.
Yeah, so we did a handful of
schools.
students in the elementary schools today and some boosters here in Town Hall.
Awesome.
So slowly but surely, I think that most people that have gotten their vaccinations or wanted to get them have gotten them. I think now we're hitting the people that either just turned 5 or are now 5 months past their second dose and can get a booster. So we're slowly
So
chipping
who are
away
you
at it.
giving the third, who are you giving the, are you guys giving second boosters yet at all, Tim? to
Not
people?
yet, not yet. That will be coming probably this fall, I would guess. I don't
Okay,
have an exact date on that. I know they're talking about the 4th dose.
yeah.
Or the next booster. On the conference call this week, Katie Brown wasn't there, so she didn't talk about that aspect of it. I don't know if you guys have heard anything out in the medical community as to what they're thinking.
So much.
I mean, special populations,
Yeah.
but not for the standard,
Okay.
not for everyday people.
Yep, so for the immunocompromised, there was the 3 doses for the initial course, and then the 4th dose, which would be the booster.
That's right,
Yep, but no talk about dates on boosters for
the rest of
the rest of
everybody
the
else.
population.
Right. Are you seeing people get that fourth shot? Are you seeing a lot of
We've
people get
heard a
their?
couple.
Not many.
Not many.
Do you
I
think
think
that's because people who are immunocompromised don't know that they're eligible to get a second booster shot, or do you think it's because they just don't get it?
they might not know that they're actually eligible, so we do refer them to their doctors to talk about it and to recommend that they do look into it. The few people that I have talked to, I don't think it's a huge segment of the population that is looking for it,
Yeah.
but I think the ones that know about it have gotten it, which is really good. I know of a few people, a handful, that have gotten their fourth. So they've done their initial 3 and then got their booster.
Have you had any general population come up to you and say, I want my 4th dose, even though I'm not in that population?
Of course,
What do you do?
we're not eligible yet.
You turn them away?
Yeah. The nurses that do the vaccinations check up on everything. So if somebody's there for their 4th dose, they obviously ask why
Yeah.
and look for some information.
Okay.
So the charts that I've been looking at and have been posting every week, as you can see on the second page, the numbers really dropped off dramatically over the past 2 months. We're actually hovering right around 12 at this point. I think we have 11 as of this afternoon at 4 o'clock. 11 active cases out of 30,000 people is really good. There are only a couple of school-age children that actually have it, that have tested positive at this point. The ones that I have on here are the PCR tests. There's another handful that have been reported through the schools regarding the at-home rapid antigen tests. So the numbers are really dropped off, which is great. The school's looking really good. We met with them this morning. There is talk of the Omicron subvariant, the Deltacron?
Delta Omicron?
Yes. They are actually talking about the BA2 strain. Makes up about 50% of the cases in Massachusetts right now, but the cases are low. Hopefully it stays that way. There has been no more movement on the 6-month to 4-year-old vaccinations. The trials that they have going on indicate that they're 40% effective at this point.
Moderna.
Yep.
Moderna just
Yeah.
came out with their release.
So we were told March or April they would be approved for that age group, but we haven't heard anything since. So hopefully next week or the week after we'll hear more as it's getting to that timeline that they initially dictated to us. So everything else has been dropping off too, such as the percent positivity, the 14-day and 7-day incident rates have dropped off significantly, which is great. Our testing numbers are also down. I think part of this is because Merrimack went to optional testing versus mandatory testing when they were doing every student and faculty member weekly. Now that's optional and probably more towards somebody who has symptoms or goes to the health center. The hospitalizations are down too, but they're hovering around the same number right about now. I don't know what you guys are seeing in your fields with.
Minimal. I don't have any of the 3 ICUs. I don't have any COVID patients.
That's
that I-
great.
that I take care of.
Okay.
And they're under for the first time in, we've never been to 0 in the hospitals in which I've been to, but they've been hovering in single digits in terms of total hospitalizations for the last week.
Okay.
Yeah, Holy Family was at 1
I think
Wow.
Tufts Post today, they were at 0 for the first time,
Wow.
I think, yeah.
ICU, I think.
Yeah, not the whole system.
No, just Tufts.
Just Tufts Medical
Yeah,
Center.
yeah.
Good. The state did change their definition of a COVID death, so we went down from
Yeah.
104 to 93, which great. So the charts that I have, the spreadsheets that I've been maintaining, I have to go through and revise the entire thing and
Brian,
find
that
all the ones
changed.
that they took out.
That definition changed.
Correct.
Is it as of that time going forward, or since the beginning of the
No, they went
pandemic?
through and revised their total counts.
Because the total count is down like 3,000 or 4,000 in Massachusetts. Right now, it's like 19,000. Otherwise, it would be like 22, 23,000 or so.
Yeah, so they changed the definition to count a COVID positive death within 30 days. So if you tested positive and then died within 30 days, they would attribute it to COVID. Versus before it was 60. So it took off a giant section of the deaths they were counting before. Well, not giant, but a good number. So we went down from 104 to 93.
So it doesn't necessarily mean that, the person died of the coronavirus. This means that the person has had that coronavirus within 30 days of death.
I think and you can correct me if I'm wrong, the overall thing is that once you get it, you end up getting multiple things, and pneumonia complications is a big one. They attribute that to the coronavirus.
Yeah, but Rochelle, as I said last meeting, Rochelle Walensky, Director CDC, she said that the people who have died of the virus had 4 other comorbidity problems, 75% of them. So,
It's just, it's interesting because, like, you have these, you know, I think of easily a handful of ICU patients that were, you know, they wouldn't have had these other insults if it wasn't for COVID to then tip them over the edge. And there's definitely a lot of patients that I took care of that died after the 30-day mark,
Okay.
but
That started from
COVID.
COVID. It knocked their immunity down, taxed their system, other things pop up.
Other
So,
superposed things
yeah.
on top of that. I mean, it's interesting.
yeah.
is the federal
Is that-
government doing that too? Revising their numbers, or just the state?
I'm assuming it came from the federal government. I think this is it the CDC that changed their definition first, or was it the state decided to do it on their own? My guess it was the CDC.
Yeah, I would assume it came from
Yeah.
CDC.
So, I mean, I guess to standardize it across the U.S. is a good thing. But like you said, a lot of the ones that I've seen through our reports, even within 60 days, somebody would get sick, and then it would tax their body, other things would pop up, and they'd be in the ICU for a while, and then end up passing away. So I don't know why they did 30 to 60, 60 to 30.
Yep.
So I haven't revised the charts yet. I'm going to go through and do those tomorrow, our weekly update. I'm anticipating I'll keep doing this probably for the remainder of the school year, just because I know a lot of parents monitor it closely. I want to see what's going on with the ages and the vaccination rates. But the numbers have really dropped off, which is a great sigh of relief. We're starting to get back into other things in our job, which is fantastic. I am working on the request for proposals for the community health assessment. I have a draft of that my counterpart in Andover and I have been working on. We met this week to go over some of the final things. So we're going to get an RFP out there, solicit bids to do this next large project, other than COVID.
Great. Do you guys follow wastewater data at all or not?
We do. I get that from the state. The
Uh-huh.
Massachusetts Water Resource Authority has seen a little uptick as well.
Yeah.
So we are seeing that. Just the numbers went down. They're back up a little bit. Not dramatically, which is great.
Yeah.
So they're still super low. But
But
I
they
have
do
been
it
hearing a
regionally.
slight uptick.
Do you get the regional updates at all or not? Because I know Lawrence tests, and I know Lowell does not, but I know that down in Essex, downtown, they do.
Okay.
Do you ever get the local data from Lawrence?
No, not specifically.
So you can get that
Okay.
if you want.
Okay.
That's from the I can send you the contacts for it.
That'd be great.
And that the only reason that matters is because what that shows is that the wastewater data goes up long before this case data, so it'll get you ready for anything that's coming. So you'll know if so. For instance, in the wastewater data, it started to spike in mid-November
Okay.
for COVID. So if you had known that there was this rapid amount of virus that was going up in mid-November, you would have known that in December you were going to be in the weeds, and you could have been ready for it.
So I know when to plan vacation.
That's right. But they'll send you that up. They will send you that, and I just use my seat on the board as a way to get access to that data.
Oh, good.
And
Okay.
they'll send you that weekly.
All right,
So
perfect.
you'll be able to track that locally here
Yeah.
in Lawrence. I don't know if
That's
they're doing it
awesome.
in North Andover or not.
No.
Yes.
So, yeah, I'd love to see that. That would be fantastic. And I get these guys ready for when we get another spike.
That's right.
That's all that I have on the code update. I think the schools are doing great. Our numbers are down. Let's hope we can maintain this. I am still getting questions on a fairly regular basis. Just the sports leagues are reached out. Friends of mine that live in town and coach soccer are like, hey, what's going to happen? What are we doing? Nope. So far, so good this year. So we're happy about that.
Thank you, Brian. And as I said in recent Board of Health meetings, certainly I feel the highlight of our meeting is the input from the medical people, and I'll turn it over to you in just a few moments. But before then, a couple bullets I quickly want to go over because they concern health. And some of the numbers are extremely troublesome and troubling during the pandemic. From the National Youth Tobacco Survey through the FDA and Center for Disease Control and Prevention, they've shown a steep increase in youth e-cigarette use and addiction. Very, very troubling. You know, you look at so many numbers as such, and they're only getting worse. Another one, for example, since the pandemic, a 25% increase in alcohol-related deaths. Right now, it's somewhere around 100,000 a year. Problems such as cirrhosis of the liver and auto accidents, 25% increase. And adults under 65, alcohol-related deaths actually exceed deaths from the coronavirus. Of course, I read this in the Boston Globe, so therefore it may not be true, but nevertheless, that's what I read in the Globe. First year of the pandemic, 30% increase in drug overdose deaths, right now in excess of 100,000. These numbers are so troublesome.
And these are things that we were working on pre-pandemic.
Yeah.
Substance abuse, tobacco control.
Yeah.
We had a task force working with the schools on adolescent vaping.
We've been ahead of the
Which was a huge
curve.
problem before.
We've been ahead of the curve and had regulations to address matters as such before even the state
Yes.
does. So
And-
we've done our job.
One thing that we have been doing, and I don't know if this is a good thing or bad thing to say this in a public hearing, but we are going to be increasing our compliance checks of our tobacco retailers. So that they call them sting operations.
Yeah. Good.
So
Good.
they're going to be, we've been working on this for a while. I started it 5 years ago, finally got it up and running with Laura's help, and getting somebody trained with new volunteers and new adolescents to go in, get the training, and then be able to go and do the sting operations with a tobacco control representative. So those will be starting up in the very near future. We've gotten the permission, we've gotten the sign-offs, we've gotten the training. Now we can do the compliance checks. They used to only one a year, which there used to be 4 up until about 6 or 7 years ago. Then with budget cuts, they cut them down to 2, and then down to 1. We're gonna get those back up to hopefully 3 or 4 a year. The penalties now, before was a $100, $200, and $300 fine with a suspension after the 3rd sale to a minor. Now it's a $1,000 fine on the first offense and a suspension.
What is that based upon? Is that
The new state regs.
state reg?
Yep.
Wow.
So.
So we
that's
could be
gonna
more,
a
but we
shock.
can't be less.
Correct.
Yeah. Okay.
So that's gonna be a shock to the retailers that decide.
I guess.
And I don't want to catch anybody, I want them to pass all of them. So we may do some notifications. And every time they pass a compliance check, they are told, they are discussed at that time. They know that they were checked and they know that they passed. So it's not, if we go in and they pass, we just leave. No, they're confronted and told, you guys just passed a compliance check, great job, blah, 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 keep up the good work. So a little positive reinforcement maybe?
Before they knew if you came in once that they were good for a year, where now they won't know when you'll be back.
Correct. And
So that's good too.
I will have our agents, who, Laura, who was working with us before, is now on as the regional tobacco control agent as well. So she's doing the entire area with her volunteers. They'll be known, make it known that there'll be more than one per year and probably multiple. So keep them on their toes.
Okay.
And maybe help curb access to a point.
Thank you.
But, okay.
And the last one that I have, and then I could just turn it over to other members of the board. Brian, you mentioned the new Omicron subvariant, it's BA.2, and I read earlier today that it accounts for about 60% of the cases in New England. It's highly contagious, but hasn't been classified as variant of concern, as both the Omicron and Delta viruses were. So we know that the vaccines and the autoimmunity provide a measure of protection against the BA.2, at least that's what I had read. But should we be concerned with this subvariant, despite not being classified as a variant of concern? So, comment, or was it just too early to say?
I mean, I think it's probably too early to say. If it's 50% of a low number is a low number.
Yeah. It's 60% as
So,
of
but
today.
But 60% of a low number
Yeah.
is still a low number. So I think that if you were to tell me that 60% of 1,000 cases in North Andover, I would be concerned about that. If you tell me that there's 60% of 10 cases in North Andover of this virus, it seems to me that the vaccinations and natural immunity is serving as some protection against it. I don't know if it's, maybe it can escape it eventually, but it doesn't seem to be doing it now.
Looks like these subvariants are going to be with us forever.
I mean, you hope you
And they
reach
never go away.
Yeah, eventually you're at endemic stage rather than pandemic stage, which I think that sort of speaks to that.
Yeah. Comment on that at all? I have another question too, on these people that have had the virus and hospitalized, and some of them are now considered to be long-termers, timers, whatever it is.
Haulers?
Is that as long haulers? Can you
Yeah.
comment further on that? As
Well-
far as, how bad is that going forward?
So I'm not a pulmonologist, so I don't see the pulmonary complications from it. As a gastroenterologist, I see a ton of people with long-term GI complications from COVID.
Really?
Yeah, I've seen people with so there's this irritable bowel syndrome is something which happens in a ton of people. 40% of people get at least short-term irritable bowel syndrome after they get any sort of viral infection. And I see it a lot of people if they have GI problems all over the place. Probably very different from the secondary pulmonary problems, but still impactful.
I'm seeing an average of 3-4 long COVID patients a day in the office.
That's down quite a bit, isn't it?
Long COVID.
Long COVID.
Oh, long COVID,
Yeah,
I'm sorry.
Yeah, no. But their biggest symptoms are just chronic fatigue. I'm seeing, the interesting thing that I'm seeing, kind of like what Max was saying, is that I'm seeing these new onsets of asthma, sleep apnea being another one. And it's more so, it's tough to tease out some of that, and I tell the patients too, is that some of this stuff may have actually been going on prior, but now you get COVID and it's just reared its ugly head. So a lot of these patients, I'm kind of just doing the basic workup, getting some lung function tests, whether or not they need any type of imaging based on how sick they were before, a fair amount of getting sleep studies now, and I actually have to say the biggest thing that I do for patients is I refer them to pulmonary rehab, which is an outpatient program. Whittier has it, Northeast Rehab has it as well, and Salem, I think Lowell General has it as well. None of the hospitals around here have it, but they defer usually to Whittier, and Anna Jakes is another one up in Newburyport. But just, it's a monitored program, and Medicare is paying for it now because for long COVID patients. And it's just kind of getting them back onto some type of exercise program where they can feel comfortable getting back to activity because they're being monitored. And I've had quite a bit of success with pulmonary rehab. Reassuringly, I have to say that for the most part, patients are recovering. you can't give them a timeline as to how long it actually takes, but as I see them in follow-up, they are making improvements. Some patients who are discharged out on oxygen, I'd say 95% are usually off of oxygen by the 2-3 month mark after discharge. So they are making improvements, but there's no set timeline. We're still kind of new to all of this. But I told patients that, yeah, you will improve. Will I ever get you back to 100% of what you were beforehand? Probably not, but these little things, and then I usually have just the discussion about vaccination. I have talked, actually, one other thing I've talked about patients is vitamin D. I'm seeing more and more data about the benefits of vitamin D as far as causing severe COVID infection. So I usually kind of just say, you might want to keep up on your vitamin D. I usually defer to the primary care doctor for checking vitamin D levels, but I'm seeing more and more data come out about is vitamin D deficiency a potential cause for severe COVID. And it's not like we don't treat them with vitamin D when they're sick. This is more of a preventative measure. So.
About a month or so ago, one of the speeches that Biden gave is he said, "Hey, you tested for coronavirus. If the test is positive," and I might have misunderstood him, or I may have didn't speak properly. I don't know, but he said you tested for the virus, you're positive, and you would get the appropriate medication. And I'm saying to myself, wouldn't you have to get that through your doctor? Did he mean that? Or did he just say that, you'll get some type of generic medicine to deal with it? I don't know. I can't comment on that.
Are you referring to like a Tamiflu or an antiviral?
Yeah, the Pfizer data really hasn't been very robust, the one that they brought out. I'm not sure which ones are coming out on top of that.
I mean, the antibodies they didn't really pan out. That the Pfizer data, when it first, that was pretty exciting right before Omicron. They had these infusions and they had Pfizer to some medicines they were giving, and I think that he was referring to the fact that he was hoping that there was going to be antiviral therapies that were more effective than what it's turned out to be.
You still have to get that through your doctor, though, I'd imagine.
Yeah, you still need to write it, but you still need to get it. You can't just walk up and say, I want some of that. I want some of that
Yeah,
medicine.
that really wasn't clear in what he said, but I assume now that's going to come to your doctor.
You still have
after
to get
the
a
fact.
prescription. It's easy to get. If you give me as a doctor, I can order it, but I have to know the person has COVID to get it. They have to tell me they have, COVID positive.
Anything else? Because the last one here is a correspondence newsletters, guide for members of public health and commissions, training video and guide availability.
They
I'm
sent
sorry,
that out already.
I didn't mean to cut you off. Go ahead if you have anything to say.
Everything we did, hometown seniors, the other day, we did do fourth shots for immunocompromised in homes because they had a little tougher time getting out. We went into the schools for medically fragile children and siblings, and we started their primary series. We did a clinic in town. Hopefully we can move beyond COVID clinics and do different clinics, but that's a TBD.
Yep.
Is our 5 to 11 consistent with what they're seeing across the state, that it's so much lower than everybody else?
Yes. Yeah. So, it's one of those age groups where the kids really weren't getting very sick. So a lot of people just said, don't need it.
By the time they were.
And by the time they were eligible and they started lifting all the restrictions and all the vaccination requirements have been lifted for the most part, I think people just kind of let it go at that point.
Did you know about the recent elementary school closure in Concord that was closed for COVID? Did you hear about that? Didn't that happen? I think like a week ago or just fairly recently. I think they had a major. Did you guys anybody hear
I
about
think
that?
it was, from what I heard, it was like a cluster within
Right.
like a classroom that like one kid got it, and then because they took the mask off and had that it spread, that they just closed down for. I believe, was it just a classroom that they closed down?
I
or
thought it
the
was a
whole
school. I thought it was a school.
I have heard of a couple different clusters,
Yeah.
but they're not attributing them to classroom-based. It's, they all went to the trampoline park together,
Yeah,
and they all happen to be friends in the same class,
yeah.
kind of thing. But that's been going on for years.
If that were to happen in North Andover, who would make the decision to close the school? Is that the school
Myself.
board? You guys would?
With the superintendent. I'd make Joe do it.
I don't want to do that. That'd be a big mistake, trust me, trust me.
We would sit down and thoroughly vet it before we did anything like that.
Yeah.
And there would be a medical need for it, I think. But we haven't seen that, luckily.
Yeah.
A couple classes in neighboring communities have had smaller groups of kids in the same classroom that have it, but they either play hockey together or they're all best friends and they live in the same neighborhood and they play together every day.
Yeah.
So it's been happening like that since day one.
Has your cancer screening, colonoscopies back up now?
It's slammed. Yeah, we're slammed. We have a huge backlog at this point because everyone's coming in to catch up.
At least they're coming in now.
They're coming in, yeah.
Yep.
Which is great.
So you had all that time off and now.
I know.
I still have 2 more years. No, another a year. Before.
It switched to 45.
I know, that's
Yeah.
what, I got the year.
Okay, and the last item on the
You don't want to talk
agenda
about colonoscopies?
is,
He's the one who said he wanted to talk about health. That's all.
the last item on the agenda is the training video. Brian, incidentally, that was sent to all of us via Tony
Yeah.
Wolfenden, about a,
so
and
take a look
she's
at
the, she's the department assistant with him, about a month or so ago, so I don't know if you want to comment further on that.
Take a
If
look
not,
at your
we need a
leisure.
motion.
Motion.
Last motion.
I'll second it.
All in favor, say aye.
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 Okay. Ayes passed, meeting is adjourned.
Very nice.